My name is Katie Jarstad and I work with Northwest Family Medicine. I'm a physician assistant. I feel bone health is extremely important as a provider. As patients age, if they develop a fracture, a spinal fracture, a hip fracture, that can be extremely debilitating. They're ending up in long-term care facilities and then failure to thrive after that. And I'm seeing patients really go downhill if they have a fracture. If that's something that I can prevent as a provider and have Dr. Blaty's specialty as part of their care, we're reducing the odds that the patient's going to end up in a long-term care facility and improving the chance that they're going to get to stay in their own personal home. As a provider, I think it's important that everybody's treating their bone health, whether it's male or female. Men are at risk as well as females especially. Any of my family members, I'm always on top of them about their screening and their routine health, and I think it's important that they're getting checked for osteoporosis and osteopenia. I do not want a phone call from my aunt saying that she has a hip fracture and now we're scrambling to figure out what to do next. If that's something I can prevent, I'm thrilled. So my patients, when they turn 65, typically at that Welcome to Medicare physical, we'll talk about bone density screening, which is DEXA imaging. I usually will submit the DEXA imaging orders to Northwest Specialty Hospital, and the nice thing is they're able to complete the prior authorization process, keeps it easy for me and the patient. And then from there, depending on what the results are and how comfortable the patient is, we'll talk about, is this a case where we need to start just calcium and vitamin D, or is this something that's going to require more aggressive therapy? I do have patients who fall under that 65 age limit, where I'm finding patients who've had a fracture, who've been on prednisone, they're menopausal, and so they're definitely more at high risk, and they really need to be seeing the specialist in that case. There's two main reasons I would use Dr. Blaty. A lot of times patients are looking for multiple options when it comes to treating their osteopenia and their osteoporosis. When they have a chance to sit down with a specialist, they feel like they're being taken care of and they're getting all of their options. Secondly, whatever treatment plan they decide, she's wonderful at completing that plan. So if it's a Prolia injection, if it's a reclassed infusion, she can coordinate that, make sure the follow-up's taken care of, and again, that the patients are getting in year from year for continuity of care. I find that the DEXA imaging in post-falls is extremely convenient for patients, especially because they're able to complete the prior authorization process. Patients are usually able to get in within a few days, and this really helps keep bone density concerns and health at the forefront of the patient's mind, versus if it's a couple weeks to get in with another facility, they may have decided at that point, I really don't need this test. I've had a lot of patients over the last year and a half that I've referred to Dr. Blaty. They've all came back really happy with their care. They feel that she listened to them, that they came up with a great treatment plan, and they're really optimistic about their bone health again.